It is 10:38 on the Talk of Chicago, 1690 WVON. You know, I want to ask you guys, when COVID hit, and if you had family members in an assisted living, nursing home, or some other kind of place, did you have or did you notice that the care for them, for your loved ones, had diminished? Were you, because you were not able maybe to visit as much, did it look like the quality of your loved one's life was going downhill? Might be a reason for that. There's a nursing home shortage and nurses, and a shortage of nurses. I'm talking to Jennifer FitzPatrick. She has so many letters behind her name, I don't have time to even go through them. She is the founder of Generations with a J, Health Education, Inc., a full-service healthcare education organization. She has more than 20 years' experience in healthcare and is also a gerontology instructor at Johns Hopkins University's Certificate on Aging program. Her mission is to help healthcare, mental health, and senior living organizations generate patient and caregiver loyalty through generous service. Welcome to the show, Jennifer FitzPatrick.
Hi, Ms. Perry. It's great to be here.
Well, I am very happy to talk to you. So what does this mean? Who is taking care of our loved ones? Is there a shortage? Of course, there were many, people, patients that were getting COVID, but there was a problem also with those individuals who care for those patients. Am I right?
Well, there was a shortage for every profession before COVID. Mm-hmm. And then what we saw...
every profession
that serves older adults.
Okay.
So nursing homes, like nurses, nursing assistants,
okay,
social workers. There's been a shortage for a really long time. Unfortunately, people don't tend to go into this field. They sort of find it by accident. So we had a shortage before COVID. And because of COVID, for one, I worked with a number of organizations where staff walked out because they were so afraid. But that said, there were very, very, very brave people that stayed, they hung in, and of course, as we've been talking about, a lot of them are very burned out. So it's really, really tough right now, not just for the residents and the families, but also for the staff.
So what does this mean for families? What do families have to do that have loved ones in these facilities? What kind of due diligence do they have to do to make sure that their loved ones are being taken care of adequately?
Well, I think it's really, really important that we never let a situation happen again where you can't have a visitor. That, to me, was one of the worst things that we did. You know, if you want to test the family members, fine. But no visitors. The family members come in and they help with feeding sometimes if their loved one can't eat.
Yes.
They provide companionship and entertainment. They give comfort. People died without a loved one. People, and I can tell you countless people that I spoke with that said that they feel that there were as many residents died of loneliness as they did of COVID. So I think we have to be really vigilant with our legislators and our public officials. We never can let that happen again when there's no visitors. You mentioned that you like to see somebody visit every day. I think it depends on the individual family. I think it depends on, because for some people, it's just not going to be possible. But call. Try to get your loved one to use technology, to use FaceTime or Skype. It only takes, you might be surprised, even if your loved one is in their 80s or 90s, get the staff to work with them, to hold a computer or hold an iPad or something like that. Mm-hmm. But keep in touch and make sure that you are communicating with the staff, because the staff if the staff, even if you're not physically there, and again, people can't always be physically on site with the family members, but if they know you're checking in and you're aware of what's going on, yes, you're more likely to get your loved one better care.
And I know that. I know that because my mother was getting such good care in that last last nursing home that she was able to get out of the nursing home. If they're not being cared for properly, it extends or it never ends if they have to stay in those kind of facilities, right?
Well, it really depends. So it depends if they're there maybe they broke their hip and they have to do rehab.
Right.
The expectation is that they're going to go home. But sometimes when somebody has a lot of issues, maybe they have Alzheimer's, maybe they have all kinds of maybe congestive heart failure, very serious diabetes.
Right.
There are times when people go into a facility or community and the expectation is that they stay there long. But I think we also, Ms. Perry, we also can't underestimate the fact that when you interface with the healthcare system, you're at risk for getting an infection from just simply being there. I mean, think about what happened in nursing homes where some facilities, now not assisted living as much, not because that's usually private rooms, but in nursing homes, people sometimes are in a room with 2 or 3 other people.
Right.
And frankly, I think it's inhumane. And I hope that our industry is continuously working toward getting people private rooms. But for infection control, it's horrible.
I never judge people who cannot take care of their families. Sometimes people have their own families. Sometimes their health is not good, their mental and physical health. And it's just healthier for families in general if these souls are in these nursing homes. I think the frustration is, are there any people want to know what is the best care I can get for my loved one, Jennifer?
I really love that you said that, Ms. Perry, because in my book, Cruising Through Caregiving, I talk about the concept of a caregiving crew, and it sounds like that's what you have.